Hello everyone and welcome to the MedMax channel. Today we are covering Peripheral Arterial Disease, also known as PAD, and we will connect it to aneurysm, venous problem and anticoagulation. So everything makes sense together. I will explain it simply and give analogies so it sticks for the NCLEX. Let's begin. Peripheral arterial disease happens when arteries in the leg become narrowed or blocked over time. Think of it like a pipe slowly filling with debris. Less blood can get through and the tissue downstream begin to starve. Common symptoms include hair loss on the legs, cold, pale skin, numbness or tingling. But the classic symptoms is intermittent claudication. This means leg pain during walking that goes away with rest. If we're talking about analogies, you can imagine a leg muscles like little engines. When you walk, they need fuel, means oxygen. If the arteries is narrowed, they don't get enough fuel and they complain with pain. When you stop, fuel demand goes down and pain fades. So, what do we find during assessment? When a leg artery is severely narrowed, blood flow becomes turbulent. Imagine water forced through the neck of the bottle. If you use stethoscope bell side, you can hear low-pitched whooshing sound is exactly what we call bruit. Here important points. Pulses may be weak or absent. You may need a Doppler to detect them. A bruit indicates turbulent flow through a narrowed artery. If we're talking about bruit, there is one exception. If you hear bruit over dialysis IV fistula, that's actually a good sign. It means the fistula is patent. Diagnosis. To visualize blockage, clinical use. We're using angiogram with contrast or CT angiography, which outlines the vessels and show where the narrowing is. In additional symptoms of PAD, we can find the leg become pale when elevated, they turn red when lowered, it's called dependent rubor, skin become shiny, dry and prone to ulcers. Let's talk about treatment. First step, lifestyle modification. Patient should quit smoking, eat fruit and vegetables and exercise regularly. Smoking is especially damaging because it accelerates arterial narrowing. We can do procedures like angioplasty and stenting, opening the artery and keep it open, endarterectomy, which means literally scraping plaque out of the vessel, and bypass graft, creating a new path for blood to travel around the blockage. Medication treatment is pentoxifylline Triad, improves red blood cells flexibility, also clopidogrel and aspirin, reduce platelet clumping to prevent further blockage. Medication treatment list is much less than arrhythmia management, which been in previous video. So, let's talk about nursing care for peripheral artery disease. Inspect feet daily. Wear white socks to avoid skin irritation from dyes. Use a podiatrist for nail care. Prevent injury and infection. Use a mirror to check the sole if needed. Nursing care quite similar as diabetic foot care. This patient have poor blood flow, so even small wound can progress quickly. If we talk about peripheral artery disease, we can skip a Buerger disease, also called thromboangiitis obliterans. Is an inflammatory disease of the small arteries and veins, especially in the hands and feet. The classic NCLEX profile is a young male smoker, usually under 45. The chemicals in tobacco irritate the vessel walls, leading to inflammation, clot formation, narrowing, and eventually blocked blood flow. A good way to remember it: It's like constantly pouring chemicals into a tiny river. The wall gets irritated, debris builds up, and the river becomes too narrow for water to flow. The symptoms of Buerger disease is cold, pale fingers or toes, numbness and tingling, color changes with cold, pain in the hands or feet with activity, ulcers on the fingers or toes. In advanced cases, poor circulation lead to gangrene. Here are some important points. Strong association with tobacco use. The disease basically does not happen without smoking. Abnormal Allen test in the hands, which means check hand blood flows via ulnar artery. Weak distal pulses. Angiogram may show corkscrew collateral vessel. Now treatment. There is only one proven intervention. Complete smoking cessation. Not cutting back, not switching to vaping. Stopping entirely. If the patient continues to smoke, the disease progresses and amputation may be required. Other supportive measures include keeping extremities warm, protecting fingers and toes from injury, medication for pain and vasodilation, which have limited benefits. Now, as a quick review, aortic aneurysm. Peripheral artery disease and aortic aneurysm, both diseases are caused by atherosclerosis. We can divide aortic aneurysm into two parts. First, abdominal aortic aneurysm, classic finding pulsatile mass in the abdomen. Very important point, never palpate, because risk of rupture, which can lead to severe back or abdominal pain, hypotension. Abdominal aortic aneurysm requires urgent surgical evaluation, often stenting. And second, thoracic aortic aneurysm. Now we're talking about pulsation in the chest. This can compress trachea, which can be cause dyspnea or stridor, and this also requires surgery. Thoracic aortic aneurysm often associated with hypertension and Marfan syndrome. Now we discuss venous problem or venous insufficiency. Here blood flow down to the leg but doesn't return properly. Symptoms include edema, warm red skin, discoloration, venous ulcers. Dangerous complication, a pulmonary embolism, usually from deep vein thrombosis. DVT has 3 risk factors, which call it Virchow's Triad. First, venous stasis, which means slow blood flow, usually heart failure or pregnancy. Second, hypercoagulability, which means thick blood, usually cancer, estrogen, dehydration. And number 3, vessel wall damage, trauma or surgery. Wound care for venous issue include elevate the legs and use warm, moist compresses if infection present. Now, anticoagulant treatment. Short term, heparin, enoxaparin, which is a Lovenox, and long term, warfarin, which is a Coumadin. This medication prevent clots from getting bigger or breaking off. So, now pharmacology strategy simplification. Arterial disorder, block platelets, which is aspirin, clopidogrel. Venous disorder, block clotting factors, which is heparin, warfarin. Or even more simple, post-myocardial infarction, use aspirin. Post-deep vein thrombosis, use warfarin. Alright, let's do a quick recap what we covered today. We talked about arterial problems, including peripheral artery disease, Buerger disease, and aortic aneurysm. These conditions all involve poor blood flow through the arteries, either because the arteries are narrowed, inflamed, or weakened. Then we move to venous problems, which as a chronic venous insufficiency, venous ulcers, and deep vein thrombosis. Finally, we compared medications. Arterial disorders use antiplatelets and venous disorder use anticoagulants. So, if video helped you understand the topic, please give it a like. And if this video reaches 10 likes, I will release a free PDF where I organized all material in a clean, structured way to help you study and refresh this concept easily. Thank you for watching. If you want more simple and clear explanation for NCLEX preparation, make sure to subscribe, leave a like and share this video with anyone who may need it. Your support really helps me continue making educational content. MedMax channel, medicine made simple.